the spotlight. In the spotlight.
Greetings and welcome to In the Spotlight. This is our podcast series where we speak to individuals such as yourself who are leading transformative change in healthcare in Southern California. I'm Adam Blackstone with the Hospital Association of Southern California, and today we're joined by Soraya Peters, Senior Vice President of ReddiNet. Hello, Soraya, and thank you for joining us today.
Hello, Adam. Thank you for having us.
Of course. To kick things off, I was hoping you might be able to share a little bit about your role with ReddiNet and what led you to this role in your journey within healthcare.
Thank you, Adam. As you mentioned, I'm Soraya Peters, Senior Vice President of ReddiNet. ReddiNet is a HASC service, and it's been a HASC service since 1971 after the Sylmar earthquake. That's how ReddiNet started. But my journey with ReddiNet, I started January 2008 and started working with ReddiNet team. And I have not stopped working with the ReddiNet team. And we have brought ReddiNet to what ReddiNet is today since 2008.
Wow. Around for 50 years, which is incredible. I don't think most people are aware of that, right? That ReddiNet has been around since
Over
the 70s.
50 years, yeah.
And so what was the technology? I know you weren't around at ReddiNet at that time, but what was the technology like at that time?
Great question. Yeah, so ReddiNet at the time was a closed-loop telephone system that the hospitals and the medical responders would have a phone system. And you can see that, in our history corner of ReddiNet about the production of these phone systems. And that's what the hospitals would pick up the phone and say, they have a situation, there is a problem, or there was a plane crash, how many patients, where are they going? And then it became later on into a DOS type of a monitor phone system that you could type on the screen, and then later on it became microwave signals. It was an intranet type of connectivity, and we had dedicated computers, or we had to send discs. Some people don't even know what discs are. Send discs to the hospitals and to fire departments and EMS agencies, and they would download it into their computer to have the ReddiNet function and communicate. And then when I joined in 2009, we went live with the web-based ReddiNet application. So now you did not have to download, and you could access ReddiNet from anywhere. And today, ReddiNet is mobile-friendly, all applications, no matter what size device you use. And we have satellite service as a backup for when hospitals' networks are not working. They have satellite services. So incredible journey of ReddiNet development.
Yeah, it truly is. I mean, to go from telephone, you're talking 50 years ago, to the technology we have available today, That's pretty incredible. And for those listeners who might not be so familiar with ReddiNet as a service, could you explain a little bit about what you do and the types of events that ReddiNet comes in and actually helps save lives, right?
Yeah. So what is ReddiNet? So ReddiNet is actually a communication system. So basically, we provide the software tool. And again, desktop, mobile, via satellite, you can use ReddiNet. ReddiNet provides you a status of all hospitals that are in ReddiNet. All hospitals, regardless they are paramedic receiving or they are non-paramedic receiving. And the status means, are they on diversion? Some people know diversion as saturation. And saturation could be emergency departments full, or CT scanners down, or the STEMI is down because they don't have a cath lab, or doctors not available, etc. So the paramedics would look into ReddiNet, and they would know which hospital can they take a patient for STEMI or stroke or trauma or diversion, and make sure they don't take someone to an emergency department where they shouldn't be if they are saturated. So we provide the status of hospitals. We also provide a hospital's address, hospital's ER phone number. So if a paramedic is new, they do not need to ask anyone else. They just look in our system and they do know where. We also provide LTC, long-term care facilities, clinic, non-acute, we call it, home health hospice, dialysis centers, statuses, are they SNF, and etc. So we have also non-acute systems in ReddiNet. And then we have mass casualty and management that you know of. And that's what you're asking, what events ReddiNet has been involved. So in mass casualty, the dispatch of a county, sometimes it's fire department, sometimes it's the county dispatch center, or base hospitals or hospitals can initiate a mass casualty, and it goes across to all hospitals that they want to participate, and they ask them, what is your capacity? Immediately they can put in, I can take this many immediate delay minor patients, and then they can send ambulances, again, through ReddiNet, without picking up the phone and making a phone call. And they can manage that whole mass casualty until scene management is done. And then they can enter patients, track all the patients. And you have a history of the entire event. For example, Metrolink accidents in LA County, a couple of them. In Los Angeles that we had ReddiNet used for initiating the mass casualty, sending ambulances, sending patients, even the airlifted patients, and tracking those patients. And then for legal purposes and all that, second by second tracking of a report that they had in their hands for knowing what happened, how was it worked, how did it work, when was a patient updated, and et cetera, et cetera.
Thank you for that. Such a critical role, right? Because there are so many players that need that real-time information, and that data is available then through ReddiNet. So you mentioned some of those players, some of the stakeholders involved. Could you share who might really be touching this tool so that we can kind of see the convergence of all these various systems within the healthcare continuum? So you mentioned fire, hospitals. Anybody else that that you might want to share?
Absolutely. All of the paramedic responders, basically first responders, so paramedics, which are ambulances, ambulance companies, aircraft companies, these are air ambulances, air helicopters that we know they land at the hospitals, the fire departments, public health departments, emergency management agencies of the counties, so EMS agencies. We have all of the hospitals, the clinic associations, and we have police departments. We even have law enforcement using ReddiNet because it's important for them to know what is happening in the county, in the area that they are working at.
Great. Well, thank you for that. That also brings another question, which is how large is the geographic reach that ReddiNet has, and what are if there are plans for expansion, what do those look like?
Again, great question. So because ReddiNet has been a product of Hospital Association of Southern California, we focus in the beginning, prior to my time with ReddiNet, even into the region of HASC, so which is Santa Barbara, Ventura, LA County, Orange County, San Bernardino, and Riverside. And then later on, again, prior to my time, we went to Northern California, so Alameda County, Contra Costa County, Solano County. And then during my time, we added 10 more counties to ReddiNet. And today we have over 70% of the population of California. It's covered by ReddiNet.
Wow. Yeah. That's a lot of coverage. How big is ReddiNet? How many employees? And if you could share maybe when you started, how that might have changed or evolved. We talked about the technology, but in terms of staff and the resources, does that look much different than it did, say, 17 years ago when you first started with ReddiNet?
Right. So that's a great question because some people say ReddiNet only has this many staff. The fact is that we are part of Hospital Association. So all of our other services is part of HASC. Within ReddiNet, as far as developments, we have 6 developers. And we have 2 quality assurance. We have a business manager, operations manager, and then our technical support is outsourced.
Which, as you think about it, is pretty amazing because you talked about all the counties and the large geographical reach, which still sounds like a pretty kind of lean staff. So you guys do a lot with the resources that you have, right?
Yes, we do. Actually, I worked for companies that we had over 100 developers and over 70 quality assurance. I'm proud to say what we developed with this ReddiNet team, it's a lot more efficient and on time to market. And we have done incredible for our customers, as you know. They are emergency responders. You have to provide what they ask for basically immediately. And this team can develop and provide ASAP.
When I think about ReddiNet, I'm thinking about the first time I ever heard of ReddiNet. And it was actually while I was working within a hospital and we were doing tabletop exercises. And so we were able to, for me, for the first time, actually interact with ReddiNet. And the staff was very, they were raving about it and talking about what a great tool it is. What are some of the things that you hear from others, say from EMS or from our hospitals, in the way that it helps them be prepared for disasters, but also just the day-to-day?
Yeah. So I want to say this because it's my pride and joy of ReddiNet that the customers, our customers, and we have testimonials of this from our customers, and it's on our website, that they just love the way it functions. When they call, they think they're the only one who called ReddiNet. When they request a change, they think they're the only one who requested a change. And every county that ReddiNet is in, we follow their policy. We implement their policy. So it's not a cookie cutter software, go ahead and use this. It's basically designed for Orange County, for LA County, for Ventura County, Kern County, El Dorado County. It doesn't matter what size the county, we respect that county's policy. And the value of a software is that it's useful for them. Not that because, let's say, LA County is using it like this, you should be using it like that. We do not use that term at all.
So tailored to the needs of the county, the population it serves. That's actually something I didn't know. Actually, I thought it was sort of more cookie cutter, not to demean it or put it down. I just didn't know that it was that intricate in terms of personalization.
I'm so proud of it that it's customized to the need of the county.
That's amazing.
Yeah.
So we talked a little bit about the geography and expansion. What new functionalities, or if there are any kind of new components, functionalities, modules that you're looking at, is there anything maybe that you're looking to explore in the future with ReddiNet?
Absolutely. So we didn't finish all features. I stopped at the mass casualty incident, but we have ability to send messages, receive messages, and all of these goes to individuals through their email and their text. So if you are not in the office and something's happening in the county, you will be alerted from ReddiNet through your phone as a text, not just going to our mobile app, but going to receive a text that says there is a mass casualty right now in Los Angeles County, for example, or in your email. We also have assessing the situation. During COVID, people wanted to know how many vaccines do you have? How many COVID patients do you have? There were assessments with 50, 60 questions during COVID time. And so it has ability to send assessments, questions to fire departments, hospitals, long-term care facilities, urgent care, dialysis center during power outages, if they need help, if they need water, if they need electricity. And then we have bed capacity. Do you have bed available? How many ICU beds? I can tell you at the given moment how many ICU beds are available and staffed in any county that we are in. The good thing is our hospitals are updating the system. They are putting the information in. And when you say the hospitals like it, because we make it simple, it's not complicated. It does not really need training. We do train, we provide training, monthly training, so customers can refresh or new staff can get trained. But it's basically pretty simple for anyone to come in and use ReddiNet. So new features. We implemented family unification. So we have mass casualty patients, which we had during the Ventura shooting. And the sheriff department was able to look and see where the patients are and help the family members where your loved ones may have ended up at, which hospital, etc. And we have the Surge. Surge is a new module that we are developing. As you know, Surge is very important. Could be pediatric, could be COVID, could be pandemic, could be any situation. And the Surge allows the person who's managing the situation, and could be a military application, could be a war, could be soldiers coming inland, and they can search and ask hospitals who has orthopedic, heart, cardiology, etc., and situations. So that's our latest module is our search. And also, again, a few years ago, we developed evacuation module, because evacuation is different than mass casualty, because evacuation could be an LTC, long-term care facility, to a parking lot, or long-term care facility to another long-term care facility, or to hospitals, etc. That could change. And we developed that for our customers to use.
Thank you. It's interesting. On the way here, I received a text about a fire alarm that was pulled. And then the first response was, can somebody look into ReddiNet and see what the issue is?
Right.
So having that visibility from the association standpoint is super helpful, in addition to EMS and all the first responders, right? Because our RVPs and our other staff can then help to support in whatever way we could. So it's very beneficial for us to have that information kind of tangentially. We don't directly provide the care, but it's great for us to know what's going on.
Yeah, earthquakes, fire, everything is in ReddiNet. We provide alerts that there was an earthquake over 4.5 in certain areas, so everybody's alerted and aware of that. Yeah.
You talked about COVID, and I know the huge role that you all played during COVID. You talked about some other mass casualty events. There's been some other unfortunate events. Can you share any of the experiences where you could say, as a result, this might have saved lives because we were able to respond much quicker than if we, had to do it the way of the days we were talking about 50 years ago? So any of those particular events, do any of them stand out to you?
Yes, great question. During COVID, one of the most important was resource request. And the resource was supplies, equipment, and staff. Hospitals needed, as you could imagine, beyond anything that they could request from the county or from the state. So what we did during COVID was we had the resource request. So you don't need to fax it. You don't need to email it. You don't need to write anything and fill out a form. You just do it electronically in ReddiNet. Automatically goes to the county processes it, goes to the Mohawk reviews it. If they can't do it within the region, they send it to the state. It was all electronic within ReddiNet. And it went to Salesforce at CDPH. CDPH fulfilled or partially fulfilled. Not only EMS was aware or the county was aware, the facility who requested it was aware, was the status of their request. And again, it could have been equipment, supplies, or personnel.
That's when I do think back at some of my other experiences. I mentioned when I first heard of ReddiNet, but then during my first 6 months at HASC, that's when COVID hit. And I was sort of thrust into this role, but I was part of some of those meetings with the various counties and would hear about those resource requests and hear about the huge role that you all were playing, which was amazing. So great job to you and your team during that time. I know that several others, amongst our staff were, of course, very pleased with the response and the way that you all were able to deploy the tool. But I know that others in the field were as well. So huge thank you for that.
Huge thing. It was $1 million question from LA County prior to COVID. Can ReddiNet make resource requests electronic? And the answer was yes. And we developed it for all the counties, not just LA, at no cost to them. Made it electronic. And then COVID hit, and they were, I don't want to say they were in heaven, but as far as ReddiNet, they were in heaven.
Yes, it made things a lot easier. I mean, you were just talking about faxing. And in 2024, almost 2025, there are facilities that still rely on technology such as fax machines.
Right.
So the fact that you have the app and you can look at your phone and pull this information up is truly incredible within healthcare.
Yeah, we are trying because we are a hospital association. I always say I'm in charge of ReddiNet, but I'm also a hospital association team member. And we want to help the hospitals. We want to help the hospital staff to make their life, what they're doing, easier. I do not want them to pick up the phone and call ReddiNet and say, I can't do this, or how do I do this? And I always want our support to be Maytag in a way and don't have calls. But we implemented interfaces like with FirstWatch to implement the ReddiNet and reduce the APOT, which is ambulance patient offload time. And incredible because it's not just tracking what's that timeline. It's let the hospital know when an ambulance is on its way. The moment that ambulance leaves the location, no matter is this the scene of an accident or somebody's house, every day, every ambulance, we inform the hospital that ambulance with this kind of a patient, this kind of a chief complaint, at this time, with this type of a unit, in this unit number, with this carrier left, and it's coming to you. They get ready for it, no matter what is the situation.
Which is a big thing for hospitals. You mentioned APOT, ambulance patient offload times. And I think it's something that unless you're in healthcare, it's not something you think about. But if there's a bottleneck in the ER, that creates one less bed.
Yes.
Patients can't be moved through the system. So you have a backlog of patients and a shortage of beds. And so hospitals are tasked with discharging and getting new patients in. And so having that tool is incredibly helpful. So you mentioned APOT. You mentioned FirstWatch. Can you share a little bit about what FirstWatch is?
Yeah, FirstWatch is a third-party software company that tracks ambulances. That's their expertise. So they work with the CAD of an ambulance company, let's say American Medical Response, and they get the information of every ambulance that it's at a scene, at a location, leaving that location, how long were they at the hospital, when did they get back to the field from that hospital. So what ReddiNet does, ReddiNet takes that information from FirstWatch, informs the hospital because we are inside the hospital, you know that, under screen all the time, 24/7 for the purpose of ReddiNet. And we inform the hospital the ambulance is on its way. And when that patient is transferred to the hospital, they call it transfer of care. It comes from the gurney of the ambulance to a hospital bed. The hospital staff has ability to say, I got this patient. And now here's your APOT. Truly, from the time the ambulance handed the patient to the hospital confirms that they got the patient. And so the interface between us and we inform FirstWatch this patient is transferred. So there are two systems. There's ReddiNet and there's a FirstWatch. We talk to each other and they talk to the CAD. And the EMS agencies see completely a unit left, got to the hospital. When was the patient transferred? What was the APOT? What was that time window? And then there are adjustments, tweaks, improvements that they have done based on that. And I can tell you from my latest updates that there has been over 80% improvements, 80% improvements in the counties that they are using this combination system. And hospitals like it because, again, with the sound, with the alert like that ReddiNet has, some emergency departments are busy, they cannot hear the sound, but they can see the light of ReddiNet going on. And they pay attention that there is something and they see it, they don't miss it.
That's incredible because the reduction in time means as a patient, the sooner you'll be seen. So I don't think a lot of people realize sort of that domino effect, that if there's a backlog, there's one less bed available for a patient, which means there might be a patient behind that patient that's going to be waiting. So your system, along with FirstWatch, make that a little bit more seamless and help to, in your case, you mentioned 80%, which that's amazing.
Amazing improvement. So we are in many of the counties right now implementing this application between us and First Watch and the CAT, or we can get the information from the CAT. So ability to interface with any software company, even our competition, it doesn't matter. We would like to help the community of the hospitals, EMS agencies, public health, fire departments, to bring everyone together with accurate information. So interface is a key thing today for any software company because nobody provides all solutions, right?
Right.
But we can embed with each other and fix whatever anybody needs to accomplish.
Yeah, ReddiNet's certainly a big puzzle piece to that issue. You do act as sort of that connector amongst first responders, hospitals, and making a more seamless continuum of care.
Right. So Adam, proudly today, we are interfacing with the hospital's EHR. It's been a journey of mine to interface with hospitals' EHR and get data that they manually update into ReddiNet, like have bed,
right,
available staff beds. We can get this information. Is not violating PHI. We are not taking medical records of the patients and bringing them into ReddiNet. We are asking for values that you manually enter, but you have it in your system. Let us have it. IT departments, due to security, firewalls, have had issues, but it's breaking. Today, we successfully have interface with Huntington Memorial, and we are receiving daily data from Huntington Memorial.
And so does that mean less manual work on the hospital side?
Yes.
So creating efficiencies there, allowing them to focus on patient care and not having the burden of
ReddiNet.
Data input.
Yeah.
Well, congratulations on that.
Thank you. Very proud of that.
There's also one other thing that I need to congratulate you on, and that's your impending retirement, which is much deserved.
Yes. Finally, after, over 50 years of working, I'm retiring January 2025.
It will be very sad to see you go. I know everybody's going to try to keep you on.
I know.
You've done an amazing job with ReddiNet and really made it what it is today. So wanted to congratulate you on that before we left this podcast today and just say it publicly.
It's been a pleasure working with ReddiNet team at HASC. My longest journey, I worked for Kodak for 14 years, and I thought that I would not have a career that long anymore. And now I'm almost 17 years with ReddiNet HASC, and I have never, ever regret even working 24/7 at some times. It's just been a wonderful thing to be part of healthcare. My background is engineering, but I just could not be happier to be part of the healthcare community that can help saving lives.
Well, you're truly valued. Your time with HASC, with ReddiNet, is really appreciated. I've valued working with you. So it's, like I said, sad to see you go, but excited for your new ventures and your ability to travel and spend time with family.
Thank you so much. Looking forward to it. Thank you.
Great. So I think that leaves us to the end now. I do want to thank you, of course, congratulate you one more time. Thank you for being here today. And I'm sure our listeners, as well as our team, appreciate everything that you've done. And we will continue to work closely with ReddiNet as an affiliate of ours. But just want to thank you.
Thank you. And I want to thank the ReddiNet team. Every single one of them. The reason I've been successful, it's because of them, because of everything they have done. They work 24/7. They work so hard. They are so supportive. It doesn't matter. It's Sunday night or Monday morning. They will respond, and they will respond immediately. Yeah.
Yes. Thank you to
appreciate such a great team.
Thank you to the ReddiNet staff as well.
Thank you.
In the spotlight.